Hi, my name is Leslie and I'm going to be your nurse today. So today we're going to be performing some tracheostomy care on you. So we're going to go ahead and make sure we confirm name and date of birth, introduce ourselves, provide privacy, GP and SP, raise the bed to a working level, gather supplies and do hand hygiene. We always want to assess the patient for pain. If they're having pain, we give pain meds 30 minutes prior, but the patient is not in pain right now, so we're going to continue with tracheostomy care. We're going to make sure the patient is semi-Fowler's. If they're unconscious, we would do sideline. So we're going to go ahead and wash our hands. We're going to drape a cloth just in case there's any secretions that comes out while we do trach care. We're going to wash hands, and then we're going to go ahead and set up our trach care supplies. And then when we add our sterile saline, we're always going to go ahead and lip it and then add it to the container. And we're going to get this out of the way. Then we're going to wash hands. We're going to apply our mask and gloves in case any secretions was to come out, if the patient was to cough or while we're doing care. We're then going to wash our hands, and then we're going to apply disposable gloves. And then we're going to go and remove the inner cannula and the 4x4, making sure we're stabilizing by holding the face plate. Remove, we're going to dispose. When we're removing the 4x4, we always want to look for drainage, the amount, color, any odor, and then we also want to make sure we look at the stoma for any signs of infection, bleeding, or any drainage. We're going to remove gloves, and we're going to wash hands, and then we're going to apply sterile gloves. Just for the purpose of this video, if in real life we was to be putting on sterile gloves and that flaps over, we would always want to start over, wash our hands and apply a new set. So we'll move this out of the way. We're then going to insert the new inner cannula. We always want to make sure that we're stabilizing the face plate and not touching the inner part, making sure that's locked. We then want to go ahead and clean the stoma. When you clean the stoma, you want to make sure you use one Q-tip or what you're using to clean with at a time, going from inner to outer. So we want to insert to the saline from inner, outer, dispose. Saline, clean the bottom, inner, outer, dispose. Then we'll want to take a 2x2. We want to pad dry, making sure we get a new one each time. Okay, and then we'll want to get a new 4x4. You always want to make sure it's a 4x4. You never want to cut it, just so the fibers don't get into the stoma, and that could cause infection. So we're going to stabilize the faceplate trying not to touch the inside of the 4x4. Again, making sure we are stabilizing the faceplate while doing this so it's not dislodged. Okay, and then using either a 1 or 2 person technique, we're going to change the collar ties. If you're doing a 1 person technique, you want to make sure you're stabilizing the faceplate. If you use a 2 person, you want to have the other person come and hold that faceplate while you're changing that. We're going to do a 1 person technique today. So again, making sure we're stabilizing the faceplate. And when we're doing 1 person, we want to leave the other trache collar on until we are finished.
That's the only thing I've noticed so far. Do you think it looks like I don't know, because you could touch the left side. I'm just going to do it.
I'm going to wrap that around.
Unfortunately.
Making sure we are stabilizing the faceplate. And then we're going to remove the old collar. Okay, and then you want to check the collar by making sure you can insert 1 finger between the collar and the neck. After that, we want to remove our gloves. We want to do hand hygiene, reassess the patient for pain, make sure that we give them their call light, that they're comfortable, and document and